Hey guys, Dr. Ben here at the Functional Medicine Center, and just want to give you some updates on stem cell and how we're doing with the patients that we're working with the stem cell injections. And first, I just want to tell you about myself. And I am 43 years old and have done a lot of sports, a lot of athletics, a lot of different things over the years. And one of the main places I was having some issues was my knees, and that was basically going up and down the hills in Colorado here. A lot of pain, a lot of irritation, no bone on bone, no decreased joint space, nothing along those lines that you would see in an x-ray, and yet even getting down in child's pose and trying to do a full bend of the knees was very painful. To do any squats, running, things like that was uncomfortable. And so I decided to do the stem cell injections coming from a place of let's be proactive, let's be preventative, let's actually try to repair something that's not bone on bone, that's not all the way to that point of, oh geez, there's not going to be a way to actually come back from this. So that was about 2 months ago, and really started seeing some changes right off the bat. By about week 6 is when it really started rolling, and this is what we see with the stem cell injections, is that that's when all of those cells, all of those differentiation is taking place, and it's going from not just a place of, okay, here, let's get a little bit more cartilage, but it's starting to go into all the different aspects of the joint tissue that could be irritating, could be damaged. And so it was about week 6 for me when it really started changing. My knees now feel pretty much like I was 20 years old. Almost like somebody went in and lubricated them. I can do a full squat all the way down, put my butt on my heels, and be able to stand right up. I get up without having to put my hand on my knee because there is a little bit of pain. No pain at all in there. I'm doing box jumps again, running, do a lot of different things. And so for me, this wasn't just a wait till I'm 55, 60, 65, when it is very painful, when I can't do the things I enjoy. I wanted to do this from a preventative, from a let's be proactive perspective. And there's not a lot of research out there on that. That's not a lot of the studies out there. And yet that's what I decided to do. And I am so thankful. Paid off dramatically. Very, very helpful. I've been backpacking a bunch this summer, going up and down mountains, carrying 50-pound packs, and way better than it's ever been as far as my knees go. So that's me. A couple other patients. One gentleman, his thumb was so bad they wanted to remove the bone, shorten his thumb. He drives semi-trucks, and there's no way he could have kept driving. The joint in there was bone on bone. It was that bad, and they said, let's just take it out, shorten it, and you'll be fine. Well, he couldn't do that. That's his livelihood. So the joint space was so tight. Normally in a joint we would actually inject into that joint, and yet for him we couldn't even get the needle into that joint. And so we did it as close as we could and around that joint. Just saw him this last week. He gave a great testimonial, but he's able to actually push up, do almost a full push-up position. He can shake hands now. He can move his thumb around, do all these movements that he wasn't able to do before. So pretty dramatic change. He was feeling so much better. He came in, did his low back and his neck as well. He wasn't quite sure if he was going to do those, but the thumb was such a dramatic change that he did that. I've got another patient that we kind of thought outside of the box as well. She's had shingles multiple times, had nerve damage, a bunch of paralysis in there. So again, not a joint problem, but more that nerve damage around the joint and going down the leg and just not able to move that leg. So we put a CC around that joint into that area, and the idea here is to get more blood flow going, get more capillaries going, and it will start rebuilding those nerves. Again, somewhere in that 6-7 week range, I got a text message from her saying, hey, that hip is feeling so much better, my leg's doing so much better. What do you think about doing it on the inside where there's usually pain and some weakness and things like that? So in the next couple of weeks, we're going to do another injection inside, and that was her coming out of the blue saying, hey, this is so much better. What else can we do? do. And so for me, same thing. This coming fall, I'm going to do it more on that preventative side as well. I broke a bone in my wrist way back in high school, and that one will give me problems here and there. We're going to do an injection in there. My shoulder every once in a while will be a little bit painful there. We'll do another injection in through there as well. So I'm really looking at this as kind of that midlife tune-up where we're going to be able to really rebuild, regenerate, and get my body to be able to handle a lot more down the road and not wait till it gets to that really painful place or that full bone on bone. So this is something we're doing for a lot of people as well that aren't quite at that place of, oh my gosh, it's either this or knee replacement. Well, let's do it like this instead of even a cortisone injection or any other things that could possibly help. But we want to come from that point of let's be preventative, proactive, build as much as we can. So if you have any questions or want to do a quick consultation, see if you might be a good candidate. Again, it's not for everybody. We're very particular about who we work with, and if it is the right joint, the right condition, we'll let you know that and what that process would look like. So hope you guys are having a great day, and we'll talk to you soon.